Okay, we should be good to go.
All right, guys, welcome to our 10th meeting of Carroll College's Pre-Medical Club, Carroll PMC. Today, we have two very special guests who are going to give you guys insight into what it's like to be a physician assistant and also be in training to become a physician assistant, the whole entire 9 yards on that matter. So we're going to follow a general meeting structure as usual. If you'd advance the next slide, Kayla. We'll start off with some opening messages. We'll then introduce you guys to our guest speakers. We'll follow it up with a good question Q&A session, and then we'll inform you guys about what our next meeting is looking like, and then have our closing message as usual. Just as a heads up, if you guys have questions throughout the process, feel free to submit it into the chat like we've been doing with the last couple of guest speakers. And then at the end, when we have that forum, we'll have you guys, or they can read them off in order and then answer them. And then anybody else who has any questions too, you can just shout them out too and unmute yourselves. But yep, thank you guys for coming, and we'll get started.
Yeah, so as an opening message, our goal with all of these meetings are to inform, excite, empower, and involve each and every one of you guys. As Andrew indicated, the purpose of this meeting is to gain greater insight into the path to becoming a physician assistant, and also what a day in the life of that is like. What's exciting about this is we'd be able to gain greater insight into the career path as a physician's assistant. And then what we wish to empower you guys is to bring the ideas and questions for the Q&A sessions after the speakers. And then we want to involve all of you guys by participating in those Q&A sessions. So really quick before we get into the main topic, is the COVID-19 community update. So there has been an increase, as many of you have known, in total cases compared to recent weeks. From last week, which was 24,818 cases in the state of Montana, to now 30,051 cases. The county numbers for Lewis and Clark County have increased by a total of 258 from last week. And unfortunately, the total deaths increased by 50 in the state of Montana, 0 being reported from Lewis and Clark County. On another topic for important information, we still have officer applications for junior officers who are interested. We're definitely looking for more leadership opportunities for you guys, and this would be a great way to step up and participate. And with that, I'd like to give a warm welcome to Stephanie and Andrew Henderson.
Hello, I'm Stephanie. I'm a PA. This is Andrew.
I'm gonna be a PA one day.
So a little bit about me. I'm from Eugene, Oregon, which is where I'm actually currently practicing. I attended A.T. Still University of Health Sciences in a suburb off of Phoenix, Arizona, and I graduated in 2019, August. I'm currently employed by Radiology Associates, and my specialty is interventional radiology.
Yeah, I'm Andrew. I went to high school in Beaverton, Oregon, and now I'm going to school at OHSU up in Portland. And currently I'm in my clinical year, and that's in emergency medicine. Sorry, I just got out of internal medicine. And yeah.
So I did my undergraduate degree at Oregon State. As you can see, my degree is actually in pre-dental. I would say until about my senior year, I thought I was going to go to dental school. But then I ended up shadowing a family friend in orthopedic medicine. She's a PA, and I kind of fell in love with the profession. Part of the reason that I wanted to become a PA was the ability to, it's our dog drinking water in the background, was the ability to change specialties without additional training. Residencies are starting to become a thing with PAs, but they're currently optional if you want to be very specialized. The other reason was work-life balance. I get to kind of leave my job at the end of the day and go home and enjoy life without taking it home with me, which is really great. And it's mostly because we assume less liability because we have a supervising physician.
Yeah, I also went to Oregon State and I majored in biology. I thought I was going to work with plants for a little bit, but I guess I liked people too much. And yeah, she actually convinced me to become a PA, but it's just, yeah, the work-life balance and the larger scope of practice compared to what I was doing before.
Yeah. Any questions so far? I can't see the chat thing. Okay. So now we wanted to be PAs, but what all does it take to get there? And this is really the most probably intensive part of becoming a PA, is kind of what it takes to stand out amongst the many applicants. The first thing that I feel like is really important is work experience. Most programs are going to want to see that you've got some not only life experience, but also some kind of hands-on medical experience. So as you can see, I was a physical therapy aide, which was my kind of hands-on experience for 2 years. And then after that, I was a surgical scribe in kind of the clinic side of things for about 2 years before I went to school. As far as the GRE goes, a lot of programs are opting out of requiring that because there's not even science on it. It's all, English, math, just really not pertinent to our profession. And then another thing is doing some volunteer work, really.
Yeah, I held down a variety of positions. I was a med aide at a assisted living facility, and then I worked on an ambulance for 3 or 4 years. And I think volunteering is what really kind of sealed the deal for me. One, in becoming like who I am and just figuring out what I wanted to do in the world, and then kind of furthering my goal to become a PA. Yeah.
Okay, now the sad part of it. It took me 2 application cycles to get in. There's a decent amount of people that get in their first time applying, but you kind of gain more work experience each cycle that you apply. Typically, I would say most programs, I think mine, there was over 2,000 applicants and we took 70. So the percentage that gets in is pretty low. I interviewed at one school, my first cycle. I interviewed at a school in Florida, and I totally bombed the interview. Was super nervous, kind of just had robot answers to the questions, wasn't personable, which I think is really important. And so I feel like you gather a lot from your first interview. Second cycle, I had quite a few more interview invites. I only ended up actually going to the 2 interviews that I got into the programs to, just because I could narrow it down. I think what changed for me my second interview cycle was probably better letters of rec. I just really pinned people down and was like, if you're going to give me a recommendation, please make sure it's the best you can. If you don't feel like you can give me a good recommendation, then I'll, find another one. I also casted a pretty big net my second time applying. I think I applied to over 10 schools, just kind of all over the country. Before my first application cycle is when I retook some science classes just to get my GPA up a little bit higher to be more competitive. As far as the personal statement, that's kind of one of your only opportunities to, shine and kind of stand out amongst kind of your work experience and volunteer experience. I can tell you that in my PA school interviews, not once did I get asked why I want to be a PA. I think that that's become kind of cliche because PA, the profession, is very popular right now. So I think explaining, how your experience has prepared you to become a successful PA, and kind of, your passion for medicine and specifically some of the things that PAs do, is probably the better route to go when you're doing that personal statement.
Yeah, I would just mirror almost everything she said. I will add that with GPAs, I know it's hard, but the upward trend is really what can make you stand out. for instance, my freshman and sophomore years were largely unimpressive, I would say. But after that, it's important to really dial in. I don't know what year y'all are in or what your graduation plans are, but it's important your junior and your senior year to really show that climb of, this is what I'm academically capable of. And even if that's not the case, you don't have the big roller coaster jump that you wish you had. You can boost, which is what I did. I boosted my GPA with a bunch of online science classes.
Yeah.
And I mean, that factors into the end grade. And
right.
I like to think that nobody meticulously poured through my
your freshman and sophomore year. Oh gosh. In my first interview, I got asked why I got a C in interpersonal communications, because they're like, can you communicate? The other thing too is to remember, like, so my GPA wasn't great getting into PA school. I was very average. I was not someone with a 4.0 or anywhere near it. And I don't know if that harmed me in getting in my first year or not. But just because you don't have, a stellar GPA does not exclude you, I think, from becoming a PA.
Mm-hmm.
The other thing too, as far as that I, would argue if I'd get asked about my GPA in an interview or something, would just to explain kind of your rigor of classes. I think, any school, whether it's, medical school or PA school, you're going to have a pretty significant, hard course load. So showing that you took difficult classes is also important. You could take the easiest classes and have a 4 point, or, you could, challenge yourself. So, yeah. Okay. Most PA schools are about 26 months. Some of them are 28 months. Also, I think there's some programs where you can get in directly from high school, and it's like a 5-year or 6-year degree, more common on the East Coast, I would say. My program did require the GRE. I don't know if that's true anymore. Didactic is considered all of the coursework stuff, pretty intense. I'd say about 23 credits every few, I think 3 months we switched over. We did Oregon-based curriculum, which is different from Andrew's experience, so maybe he'll talk about that. Oregon-based curriculum is that we learn everything in a body system. So for cardiology, we learn all of the anatomy, all the medications, patient education, physical exam, all of those types of things go in an Oregon system. I think a lot of programs are moving towards that. I felt like it was a really easy way to start, kind of put everything in a box. What did I do when I wanted to quit? Well, there was many times during didactic year, and sometimes during clinical year, but didactic year where you want to give up. I think it was probably around Christmas time in cardiology that I wanted to throw in the towel. But I think you have to remember that all the students are in the same boat as you. Like, all of your classmates are going through the same exact thing, and so being able to lean on them for support was really helpful. Also, by the time I was thinking about quitting, I had, racked up quite a bit of student loans and thinking of having to pay those off, quitting. And I think the other thing that's really important to remember, and I think this is across the board for any medical program, is that being in medicine is constantly going to put you out of your comfort zone. I don't think I will ever feel 100% comfortable. And so just realizing that you're not going to know everything, there's going to be situations that make you uncomfortable. You just keep on trucking. Resources, don't know how much you guys care about those, but there's a lot of different options to kind of help you study. So those are some of them. Pants Prep Pearls was the one I probably use the most. Up to Date is a resource I still use every day. A lot of employers will pay for it. It's pretty expensive, but it's evidence-based medical journals and things like that, as well as Pearls. Clinicals, I'd say I enjoyed about 75% of my rotations. I think it just depends on your preceptor if you're interested in that field, because we do rotations in pediatrics, general surgery, ER, family med, things like that, internal medicine. One tip I would give is that pick an elective. So I only got one elective, and I tried to pick an elective that would stand out on resumes after school to get a job, to show something that I was specifically interested in, because again, we don't do a residency. So when you come out, you're kind of this PA, that has rotated. Most programs do the same exact rotation. So to kind of stand out and say, hey, this is what I want to do, rotate in that. So.
Yeah, most programs, like she said, are about 2 years, give a couple months. GRE is kind of phasing out just because it's not really applicable anymore to a lot of postgraduate programs. Yeah, typically it's a year in one and then a little over a year in clinicals. My program at OHSU is different. It goes off of specialties kind of thing. So like we had an allergy, immunity, infection block. So we learned about like everything from asthma to ankylosing spondylitis and other rheumatological conditions. And then we had like a musculoskeletal block where it was all like, this is bursitis, and then all the trauma stuff that you can have. So, there are differences, shop around.
Yeah.
See what because you want to make sure the program fits you.
Yeah, that's super important, is like clicking with the program as well. Yeah.
And then we can go on to the next one, and we can answer all the questions at the end. I see a couple are popping up.
So what is a day in my life? So my weeks vary between 40 to 60 hours. I'm technically contracted to work 40, but I tend to work more just depending on where I'm at. My job is in IR is not a typical PA job. I would say it's very, very specialized. We do mostly procedures. I have maybe one day of clinic. So I'm not, kind of family medicine, seeing and diagnosing and all of that stuff. It's mostly procedures that I do. Let's see. My job, I'm very independent from my attendings. It's very dependent in what specialty, or even, if you're in family medicine, you'll probably be pretty independent. I'd say most surgical specialties, you're with your attending quite a bit more. I only see my attending if I have a question. My attendings are great. That would be one of my biggest tips about finding a job, especially your first job out of PA school, is to find a supervising physician that you can go to with questions, and they're not going to tell you it's a stupid question, that they're really going to listen to you. Let's see. I don't work weekends. I don't take call. I don't work holidays. That was something that was really important to me. I'd say most of my classmates that have graduated aren't working holidays. If they're in a surgical specialty or emergency medicine, urgent care, they're working weekends. I would say surgical specialties, you tend to take call, which can be in the middle of the night, which I'm not, a 3 a.m. type of person, so I don't think I could do that. Let's see. I work in Eugene. That's kind of our demographics there. I can also answer more questions specifically about what my day-to-day look like if people are interested. Things I always get asked: when are you going to med school? That is like the number one question I get asked. I get it asked probably twice a week, like, oh, you're a PA, you're going to go to med school. No, actually, I went to PA school because I didn't want to be a doctor. Nothing against doctors at all. It's just for what I wanted to do. I just didn't want to do that. And then the other thing that kind of goes along with that is like, oh, I thought I was going to see a doctor. Like, are you qualified to see me, to treat me, to do this procedure? Happens a lot. I also get that a lot because I'm female. Expect to see some 70-year-old male doctor, but that's just, it's not me. Best memory, there's this patient that I do a paracentesis, which is draining acidic fluid from usually liver cirrhosis on their belly, and I do it on him once a week, and he always tells me I have the angel touch, that because it can be a painful procedure, and it feels good to have someone be like, look forward to a procedure that's painful because I'm going to be the one doing it. So that's pretty great. As far as death, it's really easy to become jaded, I think, in medicine and kind of like push off death because it does happen. But I think the important thing is making patients comfortable and trying to be as comfortable with it as you can as a provider, because it's going to happen. You're going to have patients that die. and just kind of recognizing, I think I recognize my own mortality more, seeing patients dying, you know, again, with that work-life balance, recognizing that it's important to distance yourself from work and still enjoy your life.
Yeah. And so a little bit about my day-to-day. So I'm in the heart of my clinical rotations. My core clinical rotations is what they are. So, you know, most of my preceptors are physicians so far. I've only done 1.5, so who knows what could happen. But yeah, typically they're physicians. And they're all like, they've all signed up to teach you. And this is pretty true for, you know, whether you're in an MD, DO, or PA or NP or RN or whatever clinical program you're in, that these people hopefully signed up to educate the next generation of providers. So they're invested in you and they want you to learn. Another added benefit is, you know, hearing from Stephanie's time as a student and mine currently, I'm doing most of their charting, a lot of like the nitty-gritty procedures and stuff like that.
Yeah.
So yeah, it is very fun to be a student.
Yeah. And then I don't know what was the bottom thing there before we switch. Oh yeah, just we kind of already explained kind of like why we chose PA versus MD. And you might get asked that in an interview, like, why don't you want to be a nurse practitioner? Why don't you want to be an MD or DO? It's kind of hard to discern, but
Yeah.
Let's see what goes through our heads before, like every time before I go into a patient room, this sticks with me. One of my preceptors, I think he was my ER preceptor, said that he can learn almost everything he needs to know about a patient by just looking in the room before he goes in. I think that's pretty true. You can just learn a lot by observation, just in general in life, observing people. I think, how is the kind of like PA profession changing? So I believe it was Minnesota just passed that. I think they're the first state to pass this, that PAs do not require a supervising physician, which I think is good and bad. Having a supervising physician I haven't encountered it, but I guess can make it sometimes difficult. It's just more paperwork. So it takes a little bit more work for a practice to hire a PA because we are underneath a supervising physician for, you know, malpractice liability purposes. I personally want to always be supervised. I kind of always want someone to have my back. So I don't think I'd want to be independent. It's nice to have someone that you can always ask questions to and kind of just go at bat for you. I would say any of my attendings have done that numerous times for providers that, you know, get upset at me on the phone, or, you know, if they are concerned I don't make the right decision, then they usually go at bat for us. There's a lot of schools that are popping up, but I think the profession at some point is going to become more saturated. Right now it's not. Right now there's pretty high demand for PAs, but I'd say probably in the next 10 years or so, it'll start to become more saturated and more difficult to stand out without experience in the field. Residencies are also becoming a thing. Like I had mentioned, I have personal feelings about it. I kind of feel like it's a way to underpay PAs their first year out of school because, again, it's not a requirement. Most of the residencies are very specific so like pediatric cardiothoracic surgery, very, very specific. But there is a few more that are popping up for hospitalist positions, ER positions. But again, I have mixed feelings about it. And let's see, what did I put about expensive schooling? I don't really remember why I put that. But just that school is becoming really expensive, I guess, and loans are ridiculous. So yeah. I guess I don't know what you guys exactly wanted to hear about special populations. My job, I don't have a lot of pediatric patients. I have a lot of geriatric patients. Usually intoxicated patients, kind of what Andrew put over there, like intoxicated is fine, but being, you know, making me concerned for my safety or verbally abusing me is not fine. So you kind of just find this balance.
Yeah. And, you know, when I walk into a room and kind of what I was taught, you know, it's the history and sick versus not sick. And I think that kind of based on my next 2 points is that medicine as a whole is really developing into this team-based approach. You know, even for something like diabetes, you're getting a podiatrist in there, an ophthalmologist in there, like ophthalmologists, excuse me, and just, a whole spectrum of people that are taking care of one patient. And so, I mean, it's really nice. Even the physicians that I work with now are asking the more senior folks there, and just, rely on your teammates and their specialties and what they're interested in, what their strengths are. Special populations are, I mean, we were all children once, and some of us still are, and that's fine. And the biggest lesson that I think I was taught is that pediatrics are not tiny adults. They're so complex in so many different ways. So don't just think that it's a tiny adult. They don't think the same thoughts and aren't developed in the same ways. And anyways, such is life. But
let's see. I think I was asked about leadership. We have a lead PA. There is 6 of us currently at our practice. So we have a lead PA. He's been there the longest, and he's been with our practice like 6 years. So I don't have a huge leadership role. I would say amongst our team, though, we all have equal voice. The PAs get together and we decide kind of what we're willing to take on. If the radiologists want us to start doing new procedures, we get, we really, my attending always says he doesn't want to micromanage us. So we actually have a lot of say, which is not equal across the board amongst practices. Let's see. I've been trying to get us better benefits. We don't, I think that while we're not MDs, we still should, get quite a bit of PTO. We should still be able to maintain that work-life balance and, get compensated. If we're working 60 hours a week, but our contract is for 40, that really changes our hourly pay quite a bit. And it starts to, again, affect that work-life balance. So compensating us for that is important. Continuing education, again, MDs, DOs are also going to have to do this. There's used to be medical conferences. Now they're all online and not as fun because you don't get to travel to cool places on the dime of your employer. But we always have to do quite a bit more, I think, continuing education than an MD or DO.
Yeah, and I think this is one of our last slides, but definitely while you're a student, if you're considering becoming a PA student, I mean, focus on being a student while you're there. There's not really time to focus on anything else.
You'll have no life during PA school.
But typically boards are right after you graduate, and then supposedly it's smooth sailing. So yeah. So
kind of what questions do you guys have?
Oh, let me pull up the chat real quick.
Let's see.
Sorry, okay. So is applying to school is expensive? Yes. It really is. There's CASPA, I forget what it's called, but Central Application Services for Physician Assistants. So you have to pay a bunch of money to send out this uniformed application to all schools. So that costs like $70 to $100 a program. And then you have to fly out to interviews, rent a car, stay in a hotel or the car. So
it's definitely a struggle. I think I probably spent like $2,000 an application cycle on applying to schools.
That was probably right.
And I think. It's tough. I feel like scraping, you end up scraping by quite a bit because usually your work experience that you're getting before PA school, you're not making, the big bucks to be able to afford spending that much money on applications. Some people have different strategies. Some people are just lucky and they apply to one school and that's the school they get into. I mean, it didn't work for me. So I felt like I needed to cast a wider net. How many schools did we apply to? I think I applied to 5 my first cycle, and then I think, upwards 10 to 15 my second cycle.
Likewise, desperation is a powerful motivator. I think at the end I applied to 15 or so, but take pride in yourself and who you are, like be selective. You don't have to go to middle of nowhere Connecticut to go to school.
We both got interviews to this school in the middle of nowhere Connecticut, and we just didn't really want to go.
Typically people, because if you're gonna a real genuine answer is that if you're gonna go through the trouble of filling out the big application and write this huge personal statement that's supposed to be the epitome of your existence so far, then apply to a handful of programs that you think you have a legitimate shot at.
And I think too, like one of the biggest things that I mentioned about, when you go to interview at schools and stuff is interview them too. Ask all your questions, It's really important.
Yeah,
You're
they
going to be
love that.
spending 26 months of your life married to this program. So you want to, you want to enjoy going there and kind of fit their mission statement. So if you don't mix, I mean, if it's the only program you get into, I wouldn't blame you if you went, but mixing well with your program is important. Let's see.
Preceptors, yeah, they're a variety. They're all of the above, absolutely.
I would say
it depends.
about I'd say most of my preceptors were MDs actually. But in rotations, like, so he in his emergency medicine rotation, and same with mine, I think I had like 5 or 6 preceptors. You're not like stuck with the same preceptor, which is kind of nice about those rotations. If you're in primary care, you're much more likely to be with one preceptor. So it's a long 6 weeks, because my rotations were 6 weeks, to be stuck with one person if you didn't enjoy their company. Let's see, what were some of the other questions?
Didactic. Yeah. Standard week in didactic.
Okay, standard week in didactic. I woke up at 5. I studied. I drank 6 cups of coffee. I went to class at 8. Got done with class at 5, and then studied until about 10. That was my life for about 12 months.
Yeah, that's intense. I was
maybe not. He didn't maybe study as much.
I definitely classes are typically 8 to 5, with an hour lunch if you're lucky, and you're engaged 8 a.m. to 5 p.m. I studied most nights until 11 or so, but I mean, again, it wasn't like hard studying. I'd go work out or zone out for 2 hours, and then weekends I took off. So if you like, work for, you can have a good work-life balance and not make yourself go crazy. But
and I definitely think the burnout of didactic year is real. And so we actually I think by the end of my didactic year, I was studying and caring quite a bit less. You have to remember, when you're in either medical school or PA school, you're in the room with the best of the best, right? If you think of the stats of who gets into these programs. So you all can't be A students. It's not going to happen. There is, I think most programs are going away from ranking students, because I think that creates way too much stress and anxiety. But just remembering that, it's, not, it's about, you can't know everything. And so, I learned about, probably 8 months into didactic year that it wasn't, the more I studied, it wasn't necessarily sticking.
And also, as far as like exam prep goes, there's of course written tests and quizzes and assignments. So typically,
and hands-on exams.
Yeah, that's what I was gonna say. So the written tests are like, you get 2 weeks, I think, out, and that it's coming. That's when you start only studying for that. And then when you're not in those 2 weeks, you can work on other assignments and readings and things like that. But then for the hands-on stuff, it's kind of up in the air. It's all the time that you're preparing and practicing and stuff like that.
It's intense. I mean, I think any medical program, it's really intense. What people would tell me, and I'm not comparing this to medical school, is like, we get 1 year of didactic, and I think medical school gets out, I think, 2. And so we would basically have to learn just as much medicine, but it's very condensed. So I think people compare it to like a fire hose, like you're trying to drink out of a fire hydrant, fire hose. And it's really the truth. It's a lot of information thrown at you. And I think, and we would rotate with medical students too. And so it kind of, we were fairly on par knowledge wise, to the point of where they were in their 3rd year rotating. When we were in our 2nd year.
I've heard the comparison of the 2nd year of MD or DO school is comparable to the 1st year PA school, but that means that PAs don't get like the hard basic science stuff,
we don't
like
do the
cellular biology,
stuff.
So that's one thing. I don't know anything about the Krebs cycle anymore, but the MD students I rotate with are all about it, which is good. So definitely rely on your peers.
How can you tell if a program works for you?
So I can speak to that. I mean, the interview is pretty key.
You'll know real quick.
When and if they invite. For instance, one of my interviews, they had us do like an escape room at 8 a.m, and everybody was in a suit. And this is pre-pandemic, and it was just like, this is like a weird competitive thing, and it was in like this glass room, and so like 18 faculty members were watching us, and so that was really uncomfortable. But I think that
can't.
was their point. But anyways, I
Yeah.
didn't get in anyways. But definitely like read their website, because they'll say their mission and stuff like that. And if they're
Yeah.
all like, we love primary care, and you're like, yeah, okay, I can.
You're like, I hate primary care. I
Yeah,
can't
maybe-
see 12,000 ear infections.
Look elsewhere. Yeah.
Yeah.
But definitely, I would also say the competitive aspect. So if a program's like, you will be ranked like twice daily, and it's competitive, and we'll kick you out at the first offense, kind of thing.
Yeah.
I mean, if that's the
Yeah.
kind of structure you need, then sure. Everybody learns differently, but I mean, there are programs that are more compassionate, I would say, and fit your personality to the program if you can.
I would say between the two that I got into one in Phoenix area and then one in LA area. The vibe was very different, even amongst the applicants, the people that they were interviewing in the LA area. It was just a lot more stiff, a lot more, I don't know, just I didn't feel like I clicked with any of the applicants. I was like, well, these are gonna be my classmates. So, and you know, it was in a strip mall, which was not great. So their medical facilities weren't great. A program I went to actually had a 3D anatomy lab. So it was basically virtual anatomy as well as cadavers. And the one in California was a primary care, and I knew pretty sure I didn't want to do primary care. And so that's why, you know, I picked the other one. So
pick one that has really good basic lab stuff. So like anatomy and physiology, like go to a cadaver lab if they still have those. Good question.
PAs are salaried, most of them I know. Welcome to adulthood. A big adult job is your salaried.
Some of the like I do know a couple of PAs that are like working for urgent cares and like telemedicine visits and stuff, and that can be
Like
hourly
more per
at
diem
times.
type stuff, like extra work. But yeah, I'd say most of us are salaried. I don't know any of my classmates that are hourly. Your personal statement should not be longer than a page.
Yeah,
they have to read more than a page.
No, I'll go 2 pages. I mean, because you have to keep somebody's interest, and they're reading thousands upon thousands. You know, typically a program will get anywhere from like 1,200 to 2,000 applications, and so if you 1 page each or 2 pages each, and if someone's a 5-pager, like no, they're gonna toss that aside. So be brief and concise. As far as formatting goes, I mean, your typical paper formats, introduction, thesis. Your thesis is I'm the best and I want it to be in your program, and then a couple of body paragraphs that this is one thing I'm awesome at, this is another thing like that I really like, blah 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 blah, and the conclusion. And so really straightforward format. Nothing crazy or something that you would be unfamiliar with.
So I think that the rotations questions where it says, are you able to do rotations anywhere, or does your school pick the rotation sites? Very dependent on the program.
Another question to ask on an interview.
Yeah, my program told me where I was going. About half of our students stayed in state, half went out of state to community health centers. I stayed in Arizona. I wasn't really interested in doing community health center thing, but it was a lottery. So there was a chance that I was going to go out of state for rotations. Andrew's rotations, they pick for him. It's actually against credentialing to actually find your own rotations. You're not supposed to do that. Although it does happen. I know another girl that's in PA school right now that is doing PA school in California, but is actually rotating in mostly Oregon sites. It's very dependent.
There's a lot of logistics that the program has to figure out. Like you have to be insured in case you mess up or somebody, God forbid. But so typically the program will do it for you.
What is something you wish you would have known before starting PA school? I don't know if I can. Travel while you still can. Not maybe in COVID times, but I wish I would have taken more time off. I think I only took like a month off before PA school, and I wish I had taken some more time off just to kind of prepare myself mentally.
No, I took like over a year off, and it was awesome. I am so in the groove right now. So I would definitely recommend some if you can afford to. If you
I know it's not always financially responsible, but
it was not. Just mentally prepare yourself, and definitely sit down with your family, your friends, or loved ones, and say like, hey, like
I'm going to be absent for 2 years.
Be open and honest.
Yeah.
And invest in like important stuff.
Also,
but-
don't try to work during PA school. Don't be that crazy person. You're not going to have time to, in that minimum wage that you're going to be making during PA school is not going to make a dent in your student loans. So don't do it.
Yeah, just take it along.
Just like if you get a free moment in PA school, enjoy it. Let's see, supervising MD or DO tells you to do something that you know is dead wrong. What do you do?
Oh, this is you guys.
This is an interview question. You'll probably get it.
and MD or DO school as well. I mean, they'll ask you this question on every single ethics-based test. So you'll nail it down. Well, I would ask them what evidence they were referring to and why they think that's right. Then I would explain, well, I read this, blah, 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 blah. I don't think that's right. And then, I mean, eventually it comes down, you can't put your license at risk.
Right. That's the biggest thing for us.
And you need to be an advocate for the patient. And if,
I had, it's kind of an example of this. It wasn't like dead wrong, but my attending asked me to prescribe pain medicine for a patient that I had looked up. In Oregon, we have something called a PDMP. So you look up patients to see if they're being prescribed narcotics frequently. And the DEA keeps track of what you prescribe as far as controlled substances. And I had looked up the patient and said, hell no, I'm not prescribing that. This patient's got like morphine and oxycodone and clonazepam and everything else. And my attending was like, no, like I want you to prescribe this. And I said, all right, you prescribe it, put it on your license. I'm not going to do that. So, I mean, with my attendings, I feel comfortable saying, no, thank you. You do that. But I know that's not always the case, but in an interview situation, you got to say that you're going to talk to your attending, tell them that you feel uncomfortable doing this, ask them why they want you to do that. Like, why do you think that this is the right thing to do? I don't know.
Good question. Yeah, definitely do some soul searching for that one on your own. And figure out a way that you would realistically approach a superior to you, whether it's a senior attending, if you're a physician or if it's a supervisor.
I think that goes for anyone in medicine. Any other questions, guys? I know we've talked your ears off.
I had a question. So it's for both of you guys, for your experiences. For Stephanie, first off, with AT Still University being an osteopathic, like a holistic approach, what are your opinions or your experiences with that? And then for Andrew, how is that contrasted with OHSU's approach in how medicine, a holistic approach is taken?
So we did body, mind, and spirit courses, trying to kind of treat the whole person, not just the disease. I think it has opened my eyes a lot to be more empathetic as a provider, recognizing that I'm not just there to solve a problem, that to like take pause and ask how patients are doing, especially do that when I'm doing procedures, making sure that each step of the way that they're comfortable and so forth. Did it make or break my, I think you kind of have those feelings as, a person wanting to help other people, just kind of in your core. But I know that the DO students do a lot of the OMM courses, do like actually rotations in that. We did not. So ours was kind of limited in the holistic person thing.
Yeah. And for OHSU, Oregon Health and Sciences University, I would say that I think the direction that healthcare is going is kind of focused on what she was talking about, the whole person approach to healthcare. The kids have to be in school if you want them to not be obese later on. And so just addressing these systemic issues is really becoming like full classes in and of themselves. Maybe it's probably a lot of Portland being Portland, but I would say that the MD program, as well as the MD/PhD program is pretty osteopathic as far as it goes. I mean, we had some and then we had some of the manipulation courses, good question.
I don't think it had like a huge part of, I wish it had more of a part of our education. I think it's going that way. But
good question.
Yeah. Anyone else have any questions? No? All right. We left our emails on there. If you guys have any more specific questions, I'm pretty sure I could write a book on how to get into PA school because of how much time I spent on applying. if you guys ever in Oregon and want to shadow, if you know, whatever questions you guys have, you know, we're available to help you out. I also have one of my coworkers is in primary care in Bozeman, I think you say it, which isn't super far from y'all, I don't think. And so she might be able to take some students to shadow if you guys need some resources as well. I'd need to ask her first, but yeah.
Thanks for having us.
Yeah.
Good luck with your
Everyone
studies.
stay safe.
Stay healthy. Wash your hands. Go
Yeah.
vote.
Yeah.
Go vote.
Yeah. Thank you guys so much. We really appreciate all your insight and input, both Stephanie and Andrew.
Yeah.
Mhm. Yeah. Good to see you, Michael. Take
Yeah.
care, everybody.
Yeah.
Guys, too.
We're not related to Michael in any way. Just FYI. We're married, but we're
No.
just not,
Yeah.
it's not related. So, all right, guys, have a good night.
Yep.
Take care.
Thank you.
Bye.
Great, yeah. And so our next meeting, which will be our second to last meeting, we're planning on doing a pre-medical wellness meeting. This is a very important topic, especially as we near the end of the semester. But in addition, the entire process of being a pre-med or pre-PA is extremely grueling. And it's very, very easy to get wrapped up in your own demons and have it really in the methods by which you take to better yourself as a pre-med or pre-PA. In reality, you can get so in deep that it actually will drastically impact your pathway in a negative way amongst other aspects of your life too. And this is a pretty important topic, especially with all the stress that is going on with this year, and is sure to plague future years as well of our life. So we're going to have a few guest speakers in this meeting, discuss a few tips about this, and also share some of our own tips that we've picked up along the way about being a pre-PA or pre-med in a really healthful way.
Yeah, and with that, the parting message is finding opportunity is a matter of believing it's there. So thank you guys so much for attending this session. And we look forward to seeing those applications for junior officers, more of them as they come in. And then also, yeah, have a great weekend and good luck on exams. And as Andrew always mentions, don't forget to sanitize those laptops and have an amazing and happy Halloween.
Yep, stay safe, guys. Stay healthy.
Hey, Andrew, real quick.
Thank you.
For all of the pre-PA guys, I talked to Sherry at the bookstore, and she got a bunch of pre-PA stuff ordered because there wasn't any in stock. They'd never stocked PA stuff before. So there's shirts that are be here anytime, and then other swag will be coming later.
That's good to hear.